A 31-year-old woman, we'll call her AR, is rushed into the operating room. She's a redhead, she has ADHD, and she's 34 weeks pregnant. But her biggest problem is her placenta. It's grown deep into the wall of her uterus like roots through concrete. This is placenta accreta. As the medical team prepares for an emergency C-section, AR feels a cold sting in her IV. She expects to drift into a peaceful sleep. She's wrong. AR's body is built differently, but in a way that makes anesthesia her enemy. First, she carries the redhead gene, the MC1R. This doesn't just give her red hair. It means her brain is naturally resistant to anesthesia. She needs about 20% more gas than the average person just to stay under. Second, she takes Adderall for her ADHD. This drug keeps her nervous system on high alert. It's like her brain is constantly drinking double espressos, making it incredibly difficult to switch off. But the surgeons have no time. AR is losing blood. The anesthesia team has to act fast. They push the drugs to paralyze her muscles so they can place a breathing tube. Her body goes limp. She cannot move a finger. She cannot blink an eye. But her brain is still wide awake. To understand why AR is awake, we have to look at the GABA gate in her brain. Think of your brain like cells in a light bulb. To put you to sleep, anesthesia acts like a master switch. This master switch floods the cells with a special chemical. This chemical hyperpolarizes the cell, which is just a fancy way of saying it locks the door so no electricity can get through. When the door is locked, the light bulb stays off. You are unconscious. But in AR's brain, the lock is broken. The redhead gene made the lock the wrong shape, so the anesthesia key doesn't fit perfectly. The Adderall is acting like a battery pack, constantly trying to force the light bulb back on. While the surgeons begin their work, AR's light bulbs are still burning bright. She's locked in, aware of every sound, every movement, and the terrifying pressure of the surgery, but she's unable to make a sound. Inside, AR is panicking. She tries to shout, but her throat is frozen by the paralytic. On the monitor, her heart rate jumps to 140. Her blood pressure skyrockets. To the doctors, this looks like a normal reaction to losing blood. They give her more fluids, more medicine to steady her heart. They think they're saving her life, and they are, but they don't realize they are saving it while she's watching. The surgery is a success. The baby is healthy. But in the recovery room, AR tells the doctors something that chills them. She repeats a joke the surgeon told. She describes the exact feeling of the oxygen mask on her face. This is the one risk of anesthesia that is terrifying. In the OR, we aren't just given shots. We're fighting a battle against genetics, against pharmacology. For AR, the standard dose was a ghost. In anesthesia, our job is to be the voice for the patient who can't speak, and this is why we never stop watching the brain. Enjoyed this? Subscribe, share, and comment. I'll see you in the next case.